CBT, the complete guide to using cognitive behavioral therapy made simple. Written by Jonny Shepard. Narrated by Jessica Andrews. Introduction. Cognitive behavioral therapy is a proven form of psychotherapy that is often the first line of treatment recommended for managing depression, anxiety, worry, and other common issues. Cognitive behavioral therapy, CBT, is a typical sort of talk therapy, psychotherapy, in which you work with a mental well-being advocate, psychotherapist, or therapist in an organized way, going to a set number of sessions. CBT causes you to become mindful of mistaken or detrimental reasoning so you can view testing circumstances all the more unmistakably and react to them in a progressively viable manner. CBT can be a useful instrument either alone or in blend with different treatments in treating mental well-being disorders. For example, depression, post-horrendous pressure disorder, PTSD, or a dietary issue. As it is, not everybody who benefits from CBT has a mental well-being condition. CBT can be a successful instrument to enable anybody to figure out how to all the more likely oversee stressful life circumstances. Why it's finished. Cognitive behavioral therapy is utilized to treat a broad scope of issues. It's frequently the favored sort of psychotherapy since it can rapidly enable you to distinguish and adapt to explicit difficulties. It, by and large, requires fewer sessions than different kinds of therapy and is done in an organized manner. CBT is a valuable apparatus to address enthusiastic difficulties. For instance, it might support you manage indications of mental sickness, prevent a backslide of mental disease side effects, treat a mental disease when drugs aren't a decent alternative, learn procedures for adapting to stressful life circumstances, identify approaches to oversee feelings, resolve relationship clashes, and adopt better methods to impart, cope with pain or misfortune, overcome enthusiastic injury identified with maltreatment or brutality, cope with a therapeutic sickness, manage incessant physical side effects. Mental well-being disorders that may improve with CBT include depression, anxiety disorders, phobias, PTSD, sleep disorders, eating disorders, obsessive habitual disorder, OCD, substance use disorders, bipolar disorders, schizophrenia, sexual disorders. Dangers. By and large, there's little chance of getting cognitive behavioral therapy. You may feel genuinely awkward now and again. This is because CBT can make you investigate delicate sentiments, feelings, and encounters. You may cry, get agitated, or feel irate during a challenging session. You may likewise feel physically depleted. A few types of CBT, for example, presentation therapy, may expect you to go up against circumstances you'd preferably evade. For instance, planes on the off chance that you have a dread of flying. This can prompt transitory pressure or anxiety. Be that as it may, working with a talented therapist will limit any dangers. The adapting abilities you learn can enable you to oversee and vanquish negative emotions and fears. How you get ready. You may settle on your own that you need to attempt cognitive behavioral therapy. Or then again, a specialist or another person may propose therapy to you. Here are how to begin. Find a therapist. You can get a referral from a specialist, medical coverage plan, companion, or other confided-in source. Numerous businesses offer guiding administrations or referrals through representative help programs, EAPs. Or then again, you can discover a therapist all alone. For example, through a neighborhood or state mental affiliation, or via looking through the web. Understand the
Sample complete. Ready to continue?